Good evening, and thank you for joining the Heritage Foundation's Teletown Hall meeting with Congressman Paul Ryan and Bob Moffit of Heritage's Center for Health Policy Studies. My name is Robert Bluey, and I'll be moderating tonight's call. Tonight, we want to talk to you about healthcare reform and the debate that's just getting underway in Congress. We also encourage you to visit our new website, fixhealthcarepolicy.com. There is little disagreement that the current healthcare system needs an overhaul. Today, healthcare costs continue to rise while people have fewer choices and are less secure that the coverage they have today will be there tomorrow. However, President Obama and leaders in Congress think the solution is to expand government's control over healthcare. Proposals like the new public plan, a federal health exchange, and a health board, and even mandates on employers and individuals to offer or buy government-approved packages of benefits are all intended to give more power to Washington over the financing and delivery of health care. The end result could jeopardize the private coverage that you have today and limit your health care choices. So instead of putting Washington in control over personal health care decisions, individuals and families should be the key decision makers in their health care. That's what we want to talk to you about tonight. Our town hall meeting will run for about 45 minutes. To ask a question during the call, just press 0 and you'll be placed in the queue. I'm now going to turn the call over to Bob Moffit of the Heritage Foundation to introduce Congressman Ryan. And please don't forget to log on to fixhealthcarepolicy.com for the latest updates on this debate and key documents that we'll be posting about what's coming in of Congress. Bob, over to you.
Thank you very much, Rob. And good evening, ladies and gentlemen. Ready or not, we're going to enter into the next major debate on health care reform. In many respects, ladies and gentlemen, this is a replay of the previous debate that we had way back in 1993 and 1994 when President Clinton presented a massive health plan to Congress for the overhaul of, at that time, 1/7 of the economy. Now, health care is 1/6 of the economy, but many of the issues remain the same. How are we going to contain health care costs? How are we going to reduce the number of people who are uninsured? How are we going to improve the quality of health care? We debated that in 1994, and we are debating it again in 2009. Many of the proposals coming out of the administration, and as well as Congress, show that there are, in fact, some stunning similarities between what the Clinton administration offered in 1994 and what the Obama administration is offering now. The presentation is different, but much of the substance is very much the same. At the same time, this time, we have a comprehensive health care reform proposal that has just been introduced into Congress. It is the first bill that has been introduced this year, the Patients' Rights Act of 2009. That bill was introduced by my colleague and friend, Congressman Paul Ryan of Wisconsin. Congressman Ryan is entering his 6th term as a member of Congress. He is the ranking member of the House Budget Committee, where he works to bring fiscal discipline and accountability to the federal government. He's also a senior member of the most powerful committee in Congress, which is the House Ways and Means Committee, which has jurisdiction over tax policy, Social Security, and Medicare. Congressman Ryan has focused his recent legislative efforts in addressing the long-term fiscal crisis that is facing the United States, including the explosion of entitlement spending. He got his degree in economics and political science from Miami University of Ohio, and as I said, he is one of the leading figures in the House of Representatives pushing innovative health care reform. Congressman Ryan, welcome.
Thanks, Bob. Good to be with you all tonight. How about if I just lay out kind of what's happening here in Congress and what we're proposing as an alternative to this march toward government-run health care with our introduction of the Patients' Choice Act. It's a bill I introduced along with my colleague here in the House, Devin Nunes from California, and Senators Tom Coburn from Oklahoma and Richard Burr from North Carolina. First, let me just say where we are in the timeline in Congress. The House and the Senate have both declared the goal is to get each of their bills out of the House and the Senate by the end of July. And that means they want to wrap up and reconcile these two bills for final law when Congress comes back from its summer August recess in September. Both bills, the House and the Senate bill, claim to include what we call a public option. This government-run plan option, according to all the actuaries we've had come testify at Congress, according to the experts' analysis, leads to a government-run monopoly. I'll quickly describe why that is and how we're offering something different. Number one, when you have the government entering in as a competitor against the private sector, against private insurance, it's kind of like my 7-year-old daughter's lemonade stand competing against McDonald's. It's a stacked deck. It is the government serving in the role as the player and the referee in the same game. And it is a system in which the government pays artificially lower rates for care, and therefore the private sector plans get higher costs put onto them. This will create a death spiral in increasing insurance rates for private pay, which will force people to lose their coverage and go into the government-run plan. The Lewin Institution, Lewin Group is one of the leading actuarial firms in America. They're telling us that if this bill becomes law, about 7 out of 10 people with private health insurance in America in the next 3 or 4 years will lose their private health insurance and go dumped onto the private plan. So eventually what happens here is a public plan option becomes a government-run monopoly, because what employers face is either pay these astronomically high costs that are growing at more than 2 to 3 times the rate of inflation, or just pay a tax that's fixed at inflation instead of offering your employees health insurance. What most experts believe is most employers will say, enough with out-of-pocket skyrocket high healthcare costs, I'm dumping my employees on the government-run plan, and voila, you have the vision that they tried to accomplish in 1993, albeit in a 2-step process over a couple of years. We think it's different. We think we should go in a different direction. This plan ultimately not only requires about another $1.3 trillion in new taxes and new spending, in addition to what we already are spending on health care, but as I mentioned, it leads to the government having more control over health care. And the ultimate problem with this, with a government-run plan option crowding out the private sector, is that the government must therefore be in the position of deciding how costs are contained. And that means inevitably that the government must ration care. And we actually, in fact, have the government agency that was created in the stimulus package, the Institute of Comparative Effectiveness, already up and running, beginning to staff itself, which would be the relevant agency in charge of telling the government how health care ought to be rationed. That's a dangerous precedent. That's not the slippery slope we want to go on. With the Patient's Choice Act, we're saying something completely different. Number one, you don't need to have a huge tax increase or all this extra spending to fix this problem. We already spend more than 2.5 times per person on health care in this country versus any other country. So let's take the money we're spending right now, nearly $5 trillion over the next 10 years, and make sure it's spent more effectively and more efficiently, not through the government and not even through third parties, but through individuals, by giving individuals power and choice to buy their health care. So we propose, number one, to take the tax exclusion. We believe that the tax code right now discriminates against people who don't get health insurance from their jobs. If you get health insurance on your own, if you are unemployed, if it's not offered to you at your place of work, you are discriminated against in the tax code because you don't have the same kind of tax preference from those who get it at their jobs. So we're saying, let's take this tax benefit and make sure that it's fair and equal to everybody. So instead of having the tax deduction for people's health insurance that's given to them by their employers attached to the job, let's reattach it to the worker. De-link it from the job, reattach it to the worker, so everybody has the same tax benefit regardless of their situation, regardless of whether they change jobs or whether they lose jobs. That's number one. And what that results in is we propose that all the tax benefit go to taxpayers. $5,700 tax credit for families, $2,300 for individuals. We also think you need to reform the Medicaid program. The Medicaid program is giving second-class health care with rationing already to our underserved and low-income populations. We voucher that out with a cash benefit, $5,000 for people under the poverty line, and between $5,000 and $2,500 people for low-income people above the poverty line. This turns Medicaid into a defined contribution program, which gives these beneficiaries up to almost $11,000 to be able to purchase the kind of private health insurance that we want everybody else to have, that the rest of the country has. But we also have to make insurance work. And we want to realign the incentives of insurers so that they jive with those of their clients, of their customers, of the patients. And we don't think we should be federalizing these things like they're proposing here in Washington. We don't want to have Washington take over the micromanagement of healthcare and health insurance. So we propose to keep the reform at the state level like we have in welfare and so many other areas. We think we should set up voluntary health exchanges where people can choose to buy their health insurance if they want to through these exchanges, like an e-health insurance for each state. So you can have an apples-to-apples comparison, an easy place, a web portal or something like that to buy your health insurance. And through these exchanges, people who have pre-existing conditions, people who may have had breast cancer 6 years ago or prostate cancer or something like that, will be able to get affordable health insurance. Because we also equip the states with the tools through risk reinsurance and other things such as risk pools or reinsurance and risk adjustment. States get to choose how they do this, but it's a system at the state where everybody, regardless of their pre-existing condition, can get affordable health insurance, where the insurance companies have the incentives to keep their people healthy, to write longer-lasting contracts, and people, regardless of their pre-existing conditions, will have access to affordable coverage. We also think we need to have transparency. One of the key problems in healthcare today, one of the key reasons for high health inflation today, is it doesn't function like a free marketplace. And the reason it doesn't function like a marketplace is it's missing those building blocks in the market, namely transparency on price, transparency in quality, and an incentive to act on such things. So we propose a way of having transparency that's not government-run, not bureaucratic, but market self-regulation, much like the way the accounting standards in America are written, so that we have an apples-to-apples comparison on price, on quality, on best practices. I'll just tell you, where I come from in the Milwaukee metro area, in the Milwaukee, Wisconsin area, the price of the same kind of an MRI ranges from $400 to $5,000. The price of a bypass surgery ranges from $47,000 to $100,000. There is enormous price disparity, and nobody knows this. You don't know what things cost. You don't know who's good and who's bad. You can't get this information ahead of time. So we need to have more transparency. We also have things here which provide and incentivize preventative medicine, healthier living for the individual. At the end of the day, what we're saying, in addition to tort reform and things like that which save money, there is a key difference between our approach and President Obama and the Democrats' approach in Congress. We believe that the patient and the doctor ought to be the nucleus of the system, a patient-centered healthcare system where individuals have freedom and choice, and the providers have free market competition against each other to compete for the patient's business. That is very different than what Congress is working on right now, which is a government-centric approach, which puts the government in charge of rationing healthcare, the government in charge of designing insurance, the government in charge of deciding who gets what, when, and where. This is a dangerous, slippery slope that we're going to, and this is something we really think must be avoided, and we believe we have better ideas where you actually can have access to affordable health insurance for all Americans without new taxes, new spending, or the government taking it over. And I'll leave it at that. Anybody wants to ask questions, please press 0 to get in the queue, and you'll be next in line. Rob, right? Yeah. And Rob will actually, you're going to queue it up, right, Rob?
Thank you, Congressman. Our first question comes from Barbara, who's a Heritage Foundation member. Barbara, please go ahead.
Oh, good evening, Congressman. My question is regarding your Patient Choice Act. I live in New York State, and in New York, the counties have to bear the cost of Medicaid. I'd like to know how your Patient Choice Act can possibly reform Medicaid so that the tax burden on the counties is lessened.
Okay, so what this does is we're basically saving billions of dollars for the states and the counties, and we're saying instead of having the state government, the county, or the state run Medicaid, each Medicaid recipient will get a fixed voucher, $5,000 for families under the poverty line, and then a sliding scale from $5,000 to $2,500, in addition to your refundable tax credit to go purchase health insurance. And the Medicaid population will be able to purchase the health insurance through the state exchange. In a high mandate state like New York, where you have really high costs, one of the things we require in the exchanges is just a basic run-of-the-mill health insurance, like the standard Blue Cross option we have here in Congress, which is low on mandates and shorter in cost. And what that means is New York will be off the hook for having to micromanage and manage Medicaid. The numbers I have over a 10-year period, the Medicaid savings for New York would be $128 billion over 10 years. That is an incredible amount of savings for the state of New York that this bill would provide. So it helps your county budgets, helps your state budgets, gives you predictability. It integrates the Medicaid population into the rest of the general health care population and gives them a place in which they can shop for health insurance at an affordable rate. We also propose to auto-enroll people. If somebody is eligible for these programs, but for one reason or another chooses not to get it, they go into the emergency room with a broken leg. When they go, they'll be auto-enrolled into a plan so that they are covered automatically.
Thank you, Congressman. Our next question comes from another Heritage Foundation member, Priscilla. Go ahead, Priscilla.
I certainly appreciate what you're doing for this health bill. I really am afraid of the government control. I can see where it's very, very wrong, especially where it hasn't worked in other countries. As a senior, I am very satisfied with what I'm getting now through Medicare. I wondered, though, what I can do personally to help get this new bill across.
Well, I don't know where you're calling from, but it'd be helpful if you talk to your or call your legislator, your congressman, your senator. I'd say two things to them if I were you. Don't support this government-run plan that's moving through Congress with the public plan option, and encourage people to look at the Patient's Choice Act. You know, one of the things that I think of all people who are going to be the most prone to rationing are senior citizens. All you have to do is look at other countries, and Bob, if you want to elaborate on that.
Sure.
The people who are going to be victimized the most under a government-run rationing system are senior citizens, and that's just not right. That's morally wrong, in my opinion, and it's totally unnecessary. You ought to be in control of your health care along with your physician, and that's the kind of system we're seeking to achieve here. And that's not the kind of system we'll have if we have the government take it over. And Bob, I'll just turn that over to you.
Yeah, I would just like to make one simple point about this whole question of the government controlling health care. When it comes to controlling cost, remember this, there's only two ways to do it. You can control cost through the free market where you have supply and demand and the price is determined by the interaction of supply and demand. The only other option, if you're in the government, is the government has limited options for controlling cost. They cannot control demand. The politicians cannot control the demand for anything. What they can do is control supply. So what you have in Great Britain and Canada are supply controls. They basically set artificially low prices for goods and services in the medical system, or they impose some kind of a budget. Well, when you have unlimited demand go up against limited supply, the government has to make some very tough decisions about who gets care, when they get care, how they get care, and under what circumstances they get care. And there is no escape from that. At some point, they have to ration care. They have to deny medical treatments, drugs, devices, and medical services. And in Great Britain, for example, you have a situation where you have close to 1 million people in a country of 58 million who are awaiting hospitalization. So there is no simple answer to this outside of the market. If you want to turn it over to the government, at the end of the day, that means the government's going to make the key decisions about who gets care and under what circumstances they get it.
Thank you, Bob. Please remember, if you'd like to ask a question, to press 0 on your phone. Our next question comes from Judith. Judith, go ahead.
Hello?
Hello.
Hello?
Hello, Judith. Go ahead.
Yes, I am a senior. I'm also concerned about the cost. My doctors and I practice preventive care. I do not have many problems, but this may not last forever. But I'm wondering also whether there's be control over the cost of pharmaceuticals, which are way, way, way out of control, because I've been affected by that.
Well, our bill doesn't specifically address pharmaceuticals or that aspect of Medicare. Our bill is aimed at dealing with the under 65 population, which is what the bill in Congress is dealing with. How to deal with health care for the under 65 population. But there's one concern I have with where Congress is going with respect to prescription drugs, and that is they believe they should have the government take over the drug plan and the way drugs are purchased in order to get lower prices. And the way in which they're proposing to do that is to restrict the formulary, restrict the access of different drugs for senior citizens. I think it's 65% of most of the drugs of the last 10 years that senior citizens use are not even on the Veterans Administration's formulary. And yet they want to replicate the kind of system that the Veterans Administration has in order to get perceivably lower prices. But our fear is, unlike the veterans population, which is fairly homogeneous, they're going to do this for the 40 million people on Medicare who are senior citizens, and that means you're only going to have one or two drugs in each class that the government will help you purchase, and it will not cover most of the drugs people actually use and need and get prescribed by their doctors. And so if we're going to go down this path of the government taking more control of your access to drugs, the only way the government can make sure that those prices decline is to restrict what drugs you have access to. And that is something we really don't want to have happen.
Thank you, Congressman. Our next question comes from Kishore. Go ahead and ask your question. Please remember, if you'd like to ask a question, to please press 0.
Hello. Now, my question is about communicating this idea that you have of free market-based health care. It was tried in the last election campaign by John McCain, but it's quite clear that it was not communicated effectively. By contrast, Obama is able to communicate it effectively, and he's able to get across a bad program across, but for some reason the good program is not having an impact. What plans do you have to improve communication?
Well, I think that it is critical for members of Congress, and it's also critical for people who are in the policy community, to make it very clear what exactly is at stake in terms of the health care debate. A lot of the health care policy issues are rather complex, but at the end of the day, these issues ultimately boil down to a few very, very simple questions. And here's what the questions are. At the end of the day, who is actually going to control the flow of dollars in the system? Who is going to make decisions about where those dollars go? Who is going to make the key decisions about what kind of health care benefits package you have, what kind of plan you have, what kind of relationship with your doctor you are going to have? At the end of the day, those are the key decisions. I admit that during the campaign, Senator McCain really struggled, I think, in articulating a coherent vision of his health care agenda, even though, frankly, most economists probably agreed with where Senator McCain was going. But the key question here is not simply a question of economics, it's a question of values. Ultimately, who is ultimately going to make the decisions about that area of this sector of the economy which has such direct personal impact on the quality of your life? I think we have to frame this debate within the framework of individual control, whether it's going to be patients and doctors, whether it's going to be the control of healthcare decisions by individuals and families, or whether it's going to be controlled, whether those decisions and whether that control is going to be exercised by government officials in Washington. I think ultimately the American people will support the idea of individual freedom and personal responsibility if it is framed correctly. And I think that's what Congressman Ryan and his colleagues in Congress are trying to do. And I, for my part, and my colleagues at the Heritage Foundation, we have always framed this debate in terms of individual freedom and personal responsibility.
And I'll just simply add on to that. You're right about President Obama he's the most gifted communicator we've seen in a generation. And the rhetoric they're using is wonderful sounding rhetoric. It's just, we want a public plan option to give you more choice and competition. If you like what you've got, you can keep it. The problem is that rhetoric doesn't match up with the policies they're trying to push through. And it is our job in the loyal opposition, the minority, and the policy community to make sure that people really truly understand the consequence of these ideas, the consequence of how this will do the exact opposite, how people will lose their private health insurance that they have, how they will limit their choices, how they won't be in the driver's seat. And so it's our job to tell the truth, reveal the facts, show the analysis. But I also believe by introducing the Patient's Choice Act, we also have an obligation of saying, hey, look, we can do those things. There's a better way to go. We can do it not with the government taking the system over, but by making the individual more powerful with the resources to go buy health insurance, more powerful with the ability to get affordable health insurance where they can't be cherry-picked in the marketplace, more powerful because they're equipped with information on how to get health insurance, how to get health care that is best in quality, best in price, and what at the end of the day, we do not have that kind of a system right now. We don't have a functioning market system that revolves around individual patients. We want that kind of a system. And the question is, where does the power go? Right now the power is in this third-party blob. Insurance companies, employers, providers. Is it going to be shifted over to the government, or is it going to be shifted over to the individual? And that's what really, at the end of the day, this is all about. And we've got to get out there and communicate this, and that's why we're doing things like this tonight.
I would just add one fundamental fact, that since the introduction of the Patient's Choice Act, I've been heartened by some of the response, not only in the policy community, but in the press. There was a major editorial in USA Today, one of the nation's leading newspapers, that referred to the Ryan bill as one of the most innovative health care policy initiatives. The fact is that this is a real bill. It's actually been introduced. Many of the liberals in Congress are struggling to try to put together a bill that will be somewhat acceptable to the broad public. They're struggling with it because a lot of the proposals that they are trying to promote are actually going to be very unpopular when in fact the details are revealed. So I think that we are starting to make headway on the communication. And I think that what we have to do is we have to continue to articulate the fundamental vision, which is, again, individual freedom, personal responsibility, an emphasis on quality, and an emphasis on innovation and an improvement of the general health of the American people.
Thanks, Bob. And I'd encourage anyone who wanted to look at to more detail on Congressman Ryan's bill to check out our website at fixhealthcarepolicy.com. You'll see a link to the bill right on the homepage there. Our next question comes from Dorothy. Dorothy, go ahead.
I absolutely have a good hospitalization and medical policy. I want to keep it. I don't want anything to change with mine. Will I still be able to keep what I have, or will I be forced into a government-run operation?
Let me ask you a question, Dorothy. Does it come from your employer?
No, it comes from my husband who worked for the government. And it is their, my prescriptions come from Medco, and I'm trying to think offhand. You caught me unexpectedly on this program.
I just need to know your situation in order to answer your question. Well, if your husband's a federal employee or a federal employee, I don't think much change will occur in your situation. If you were going to say, yeah, we get it from my husband's job, which is not the federal government but something else, I'd say the actuaries say there's a 70% chance in the next few years you'll lose that and have to go into the government plan. And by the way, I'm a federal employee as a member of Congress. I am in the same system you are. It's called the Federal Employee Health Benefit Plan. And in that range of plan, you and I have a choice. We get about 12, insurers to pick from. And guess what? They're all private insurers nationwide. None of them are government insurers. And so we're talking about a new bill that will create a new plan option that's to the left of the one that we as federal employees even have. So we just are very concerned that for those of people who get it on their own, get it from their jobs, that they're not going to be able to afford it because all the private health insurance in this country is going to go skyrocket in price, and that's going to cause people to go on the government plan, which means the government eventually crowds out the private sector and in a sense becomes the monopoly program. And in order to contain costs, the government ultimately has to ration care. It's a mathematical fact, and it's really wrong. I mean, you have a 57-year-old from Canada who was denied his artificial hip treatment last year because they said he was too old. You've got seniors in England who are being told they just can't get their hips replaced or their cataracts because of their age. You've got people waiting 14 weeks on the waiting list in Canada for their bypass surgeries. Look, if you've got clogged arteries, you need to get those things cleaned out tomorrow, not in 14 weeks. And that's what we want to avoid in America. That is not America. That is not what this country is all about. But unfortunately, the great rhetoric that you're hearing in America today is paving the way for the kinds of policies that will bring those kinds of problems right here to our shores. And that's why we're not only trying to defeat it, but we're trying to offer a better alternative, which puts patients in charge.
I would just like to follow up with one point, and that is that you are in an unusual healthcare system because you and other federal employees have an opportunity to do something that most Americans don't do, which is you have the opportunity to pick and choose nationwide from more than a dozen plans on a national basis. But beyond that, there are altogether about 283 private plans that compete with each other for consumers' business. And you can do something, frankly, that most Americans cannot do. If you are dissatisfied with the quality or the service or the benefits that are offered by those private plans, you can fire them. And being able to fire them is a very, very wonderful thing. The truth is that many of our health care arrangements that we have today are not as accountable as they should be. And what Congressman Ryan is trying to do, and his colleagues in Congress, is to make health care plans and providers more directly accountable to the patients.
Thank you, Bob. Our next question comes from Carol, another Heritage Foundation member. Carol, go ahead.
Hi, Congressman Ryan. I have a couple of things to say. I support you completely. I do not want the government deciding my treatment at bedside, my doctor, my government. I want to choose my own doctors. I'm very aware of what's coming down the pike, and that upsets me, quite frankly. I spoke to several of my doctors, and they don't know anything about this. Oh, this will never happen. We'll never get universal health care. This is not going to. Don't worry about it. How can we do something when we're in the minority? And if you're not in the majority in Congress, what can we do to stop this from happening? Because as you know and I know, things are happening very, very quickly in this country.
Well, you just touched on some important issues we should get into. Very good question, by the way, Carol. Number one, the speed at which this is happening. They did something unique. They, meaning the Democrats, did something fairly unique this year legislatively, and that is they use this tool called reconciliation. It's something that you use the budget process to fast-track legislation through Congress. It limits debate, limits amendments, and prevents filibusters in the Senate, and means that you only need 50 votes in the Senate to pass a bill, unlike 60, which you normally need, and only no more than 35 hours of debate in its entirety between the House and the Senate to pass legislation. They put those rules on the health care legislation. So we're going to have legislation that takes over 17% of our economy, that is so involved in our personal affairs like health care, with no more than 35 hours of debate between the House and the Senate, and really no chance to stop it in the Senate like you normally have with legislation. And that's happening now. And these bills are scheduled to pass in July, and the law is scheduled to occur in September, maybe October.
And so they fast-tracked this with very, very little public debate. What they've done this year versus 1993 is in 1993, the health care bill failed in Congress, a democratically controlled Congress. And they put that bill out there about 3 months ahead of time so the public could see it. And what happened was they put that bill out there, and people in the media scrutinized it and looked at it, and America turned away from it, rejected it, and they got their elected representatives in Congress to vote it down with a Democrat majority. That's not what they're doing this year. This year they haven't even shown us a piece of legislation yet. They've had hearings, press conferences, they've issued white papers, but no bill. The only bill that exists is the bill that I, along with Tom Coburn, Richard Byrne, and Devin Nunes, authored, the Patient's Choice Act. So they've played it tactically much more intelligently. No bill means no scrutiny. means no media attention, means no constituents can actually see what Congress is doing. They're going to release this bill in a few weeks. It's going to be marked up in our committees the next week. It's going to be on the floor of the House and the Senate the week after that, and pass out of here before the public even knows what's going on. And so that is what they're doing legislatively and tactically that's different. And that's why your doctors don't know about it, because they haven't seen exactly what's happening. And the concern I have this time around versus last time around is the providers that are going to be so deeply affected by this, the doctors, the hospitals, all the different healthcare providers. They don't know what's coming. They don't realize what's happening to them. And I'm very fearful that who's going to want to practice medicine in a world in which you're effectively a federal employee, in a world in which it's Medicare for everybody. And the problem for Medicare for everybody with respect to providers is they don't even get paid in many instances what they cost, and care must be rationed. They just denied all Medicare beneficiaries virtual colonoscopies for cost reasons. A virtual colonoscopy, I'm told, is much better than a real colonoscopy. These things are denied in Medicare for cost reasons. I can go on and on and on, but the point I'm trying to make is providers don't know it's coming yet because they haven't seen the details, because the president and his party have done a very good job of keeping the details out of public, not even showing colleagues in Congress, and they're going to spring it on us at the very last minute and then pass it.
Thank you, Congressman. Our next question comes from Luan. Luan, are you available?
Hello.
Hello. What's your question?
Hi. Well, basically, I've been very concerned about all the fraud and waste that is in Medicare. I've heard anywhere up from $60 to $100 billion a year. And I was just wondering if you feel if all this stuff was privatized, that it would eliminate maybe not all, but a great majority of the fraud and waste that is in these programs, and basically then help cost us less.
Let me take that question. I think it's a very, very good one. In Medicare, you've had problems with waste, fraud, and abuse for many years. As long as I've been in Washington, I was with the Reagan administration, we had every year some kind of a campaign to try to root out waste, fraud, and abuse in the Medicare program. It's very, very difficult. It is a constant problem in Medicare. It's actually even worse in Medicaid. There's one major reason why that's true, and that is all of the financial decisions are opaque. There's nothing transparent here. All these decisions are being made by third-party administrators, so the money is being handled by all kinds of other people. The money is not being directly handled by doctors and patients. However, not too long ago, there was a wonderful demonstration project conducted in Florida under Governor Jeb Bush dealing with Medicaid, and it was called Cash and Counseling. It was for the Medicaid program, and what Governor Bush was able to do was to secure an agreement from the federal government to allow him to set up for disabled persons basically the equivalent of some kind of a health savings account for Medicaid services for people who were disabled. It would get cash, and of course, because these people were disabled, they had a counselor. The effect of it is that the patients themselves actually wrote checks directly to the provider. The checks did not come from the Medicaid bureaucracy. Well, that program has been subjected to a number of analyses, including analyses by the Robert Wood Johnson Foundation and Mathematica, one of the top econometric firms that examine healthcare policy. And one of the things they found, besides tremendous patient satisfaction for these Medicaid patients, is that there was virtually no fraud. That is to say, when you have a direct transaction between the provider of a medical service and the patient, you are much less likely to get the kind of fraud that is now routine in government third-party payment arrangements, particularly in Medicare and Medicaid.
What state are you from, Malone? Are you on still?
I don't think so, Congressman.
Well, I was going to give her the numbers of Medicaid savings we achieve in our bill, but let me say one thing. I serve on the Ways and Means Committee. I'm on the Health Subcommittee. That means there's a handful of us in the committee who sit around playing Caesar, putting thumbs up or thumbs down on provider reimbursement rates, on how providers get reimbursed for anything from wheelchairs to oxygen tanks to hospital beds to what hospitals get paid for this or that. And I got to tell you, Medicare pays the same no matter whether it's a fraudulent provider or a good provider, whether it's a good doctor or a bad doctor, whether it's a hospital that has poor quality rates or good quality rates. So the federal government pays the same regardless of quality. That's point number one. Point number two is you politicize the process when you have the government paying for health care. It is the special interest groups that come to Congress and come to the federal government and lobby for their own reimbursement rates to pad their pockets to pay for whatever service they're providing. It is not a system that is set by the market. Let me just tell you about just durable medical equipment. That's oxygen and wheelchairs and things like this. It is not a system where the patient gets to shop for value, gets to compare prices. It's preset. They're billed by Medicare. The taxpayers pay about 75% of the cost, and it is not a system in which you get market-based prices. We've looked at what would it cost in the free private market to buy such equipment, the same identical equipment, and it's far, far less. And so when you have the government doing the paying, setting the prices, which are influenced by special interest groups, you have a system where the government, in some cases, overcharges for these things, where the market could provide a far better standard of care, better quality care at a lower price. Look, if you push competition out of the system, then you're not going to have higher quality and lower prices. And in government-run healthcare, and we have a few programs that are government-run healthcare where there's no competition, we in so many cases have higher prices and lower quality. And that's where a lot of the fraud abuse comes from.
Thank you, Congressman. We're nearing the end of the call, but I do want to give Irv a chance to ask his question. Irv, are you on? Go ahead.
Yes, I'm here. I'm curious because my background is such that I've had dealings with legislation nationally in my business formerly, and I'm hopeful that you folks will put together a program to help us contact our people and state our case in a way that causes the politicians seem to pay attention if they get a lot of messages from us, and I'm curious to see whether or not you folks have got some plan in mind to have us be able to address the issue of the program you're trying to promote.
I'm going to let Bob take that. This is Paul Ryan. But let me first say, I don't think it's inevitable that this government-run plan option occurs. I don't think it's inevitable that Congress steamrolls through legislation taking over the healthcare sector. And the reason I say that is we thought cap and trade was inevitable, and I think we're probably going to defeat that legislation. Even though the Democrats run Congress and they want government taking over healthcare, the American people are still their bosses. And if the American people in the months of June, July, and August speak up to their elected representatives, I still think the American people can tell their bosses they don't want this. And this can therefore happen, and that can be stopped if the American people get the word and pass it on to their legislator. And I'll just pass it over to you, Bob.
Sure. Congressman, thank you very much. I would say this. The most important thing that we have to do in this debate is to educate ourselves and our fellow citizens, our family and friends. The Heritage Foundation is not a lobbying organization. We can't go to Congress and lobby for any particular legislation, but we can educate the public and we can educate the Congress as well. one thing that I would recommend everybody do is to go to our website, fixhealthcarepolicy.com. One word, fixhealthcarepolicy.com, and get as much information as you possibly can on what the options are, what the bills are before the Congress, what the analyses are, what the impact will be on individuals, on families, on employers, and on employees, on doctors and hospitals and other medical professionals. It is important, it's really critically important in this debate to follow this debate very closely. It's critical to keep on top of what is happening in Washington every day that members of Congress sit and debate this issue. Now, very soon, these matters are going to go before the Senate Finance Committee and Congressman Ryan's committee, the House Ways and Means Committee, and there are going to be hearings and markups. There's going to be consideration of this legislation. It's really critical to follow this. And as far as the Heritage Foundation is concerned, we're going to be providing on a regular basis solid information. So once again, contact us at fixhealthcarepolicy.com, and we'll do our part to keep you informed, and in keeping you informed, you can fight for your personal liberty.
Thank you, Bob. I want to thank both you and Congressman Paul Ryan for joining us tonight. And I'd encourage everybody to check out the website, fixhealthcarepolicy.com. And tomorrow we will provide a recording of this phone call so you can listen back and hear what the Congressman and Bob Moffit had to say. And we do hope that you'll keep in touch with us. You'll sign up for our email newsletters and get more information on healthcare policy as this debate moves forward. Thank you again for joining us this evening. It was great to have you on the phone and spark this conversation. Have a good evening.
Thank you.